Thank you for joining us today. At this time, I'd like to turn it over to Carrie Savage from the Department of Behavioral Health and Developmental Services. She is with the Office of Child and Family Services, and I believe she's here, so that would be great.
I am. Hey, Elaine.
Oh, yay! Hey, Carrie, come on.
Good morning, everybody. Thank you so much. Thanks, Elaine, for the introduction and for one, for hosting, and two, for making sure that everybody has all the technical details that they need in order to be successful today. Very important. Good morning, everybody. My name is Carrie Savage. I'm the incredibly proud director of the Office of Child and Family Services here at the Department of Behavioral Health and Developmental Services. And I guess if we all spoke in alphabet soup or acronyms, you could say I'm the director of OCFS here at DBHDS, which sounds so much more concise, but doesn't make a whole lot of sense. I have the honor and privilege of introducing Dr. Mellenbeck today to speak to you all. I am excited for you all to be able to participate in this because I think one thing that we're really, really good at as practitioners is that we give everybody permission to work on their own resilience and coping, but don't always give ourselves the same permission. So I'm very intrigued and excited about you all having the opportunity to pause for a minute and be able to learn a little bit about how you can give that gift back to yourself, the same gift that you give to your clients every day. And I know that Dr. Mellenbeck, excuse me, is the perfect person to deliver you that information. I am hopeful that you all will learn. I am hopeful that you all will take a moment to pause for 2 hours and to listen and to learn and to give yourselves the chance to absorb this information so that you can take it back to practice in your own daily life, with your clients, with yourself, with your partners, with your families, with your kids, with whoever it is that feels applicable. So make sure that you're in it to win it today. I know 2 hours is a long time, but I am hopeful that this will maybe feel a little restful and a little rejuvenating. So with that, I will turn it over to Dr. Mellenbeck, and thank you so much for being here with us today. I hope you all have an excellent training. And if there's anything that I can do to support you, please do not hesitate to reach out.
Great. Thank you so much for that kind introduction. I just definitely want to thank Virginia Tech, Richmond Center, and DBHDS. I'll use the right acronym for inviting me today to share. So hopefully everyone can access the Google Doc. Okay, Brian said yes, it is accessible now. So I just changed the permissions. So if you did not get the handouts, you have them now as the Google Doc. Okay, hold on. So, okay, can you all see that? Can I get a thumbs up somewhere?
You're good.
Yep, good. Thank you. Okay, so I am going to try to keep an eye on the chat as well, but Elaine's going to help me with that during the talk. So feel free to put questions in. As everyone has said, please take time you need, but we'll take a 10-minute break around noon. And I do want this to be interactive. It would be really boring if I sat and talked at you for 2 hours. So we don't want that. I want to get your thoughts, your input as well, because you're there. You're the boots on the ground doing this work. My name is Robin Mellenbeck, and as you kind of saw and read, my day job is I work as the director for the George Mason University Center for Community Mental Health. We're the main training clinic for doctoral students in clinical psych, but we also train counseling students, social work students. We also introduce undergrads to practical experience in behavioral health as well. We're part of the statewide Youth Mental Health Corps. We do a variety of training. All of this with a commitment to providing affordable, accessible mental health services to the community that are also culturally sensitive. So that's kind of my day job. And then I also love talking to professionals about how does resilience interact with our work? So, back screens. How many of you are familiar with this? Good morning. Let the stress begin. Whether it is just the alarm going off, whether it is, oh my goodness, I just remembered 5 things I didn't do yesterday. I've got to get my kids to school. Oh my goodness, there's a delayed opening yet again, or something along the lines of all of these things. So thinking about how often we start the day with stress keep that in mind for the end of this presentation. Okay, and so what are we going to do today? We are going to talk about why it's important to take care of the caretaker. I don't think I have to convince you of that, but we're going to talk a little bit about why. We're going to talk a little bit about burnout, then what resilience is and what resilience is not, because there are people who I don't want you to leave this presentation saying, if only I do more self-care, then I will build my resilience. It's more than that. But we are going to identify coping skills. We're going to ask each of you to develop your own self-coping resilience plan before the end of today, making a commitment to actually trying some of these things over the next 2 weeks. And as we said, we'll take a short break around noon. I love this. I do put little kind of fun things in my presentations, but this says, sometimes I just want someone to hug me and say, I know it's hard. You're going to be okay. Here's chocolate and $6 million. Okay, burnout. Again, you all are probably familiar with this, but the official definition of burnout is a state of emotional, physical, and mental exhaustion due to prolonged or excessive stress, often related to work or responsibilities, leading to a loss of motivation and a feeling of being overwhelmed. So again, burnout is a stress response. It's not actually a medical diagnosis. Feels like it because of all of the medical and the physical symptoms that come with it. But it is a stress response. And often when we talk about resilience, we're talking about combating burnout. And again, we're going to see that those are slightly different things. Having said that, burnout, 46% of health workers reported feeling burned out in 2022, up from 32% in 2018. And if we think about that time frame, that also was just post-COVID. So, the burnout rates across all health professions have just skyrocketed. Scores, when they actually do a measure of burnout, scores average about almost 60%, which is pretty high for those folks who are acknowledging that they are burned out. What does it look like? And again, many of you may be familiar with some of these symptoms. The biological symptoms, we're talking illness. Your immune system actually goes down when you have a chronic stress response. Headaches, low energy. We talked about that motivation. So the psychological, decreased motivation, decreased belief you can do anything, increased anxiety and depression, difficulty focusing. The interesting thing, I am a woman in my middle age. I will acknowledge that. And, perimenopause and menopausal symptoms cross over with a lot of these, both psychological and biological symptoms. And so, it is really important if you're feeling like you're having this low motivation, low energy, to get a physical. Make sure you talk to your doctor. For those of us in my age range, we want to make sure that it is not related to perimenopausal or menopausal symptoms, because there are things they can do for that. Having said that, if you're not in our age range, there are other medical things that can be causing a lot of these same symptoms. If you find yourself, though, dreading going to work in the morning, we want to think about burnout too. The social piece, again, often with burnout, we're seeing isolation, social withdrawal, challenges. It affects our relationships, whether it's with significant others, friends, kids. And then this I always found very interesting when your colleagues start to get more cynical. They're not somebody who's got a sarcastic sense of humor, but they get more cynical. That's a little red flag for some burnout. All right. So I like to include this also. When do you need more help? I already mentioned getting a physical. I think that's kind of we ignore our medical stuff. Okay? Caretakers, behavioral health providers are notoriously bad about taking care of yourself, not only emotionally, but physically. Please, please, please see your doctor, get a physical. Okay? But if you do have symptoms similar to this emotional exhaustion that interferes with any kind of functioning, you're late for work every single day because you can't get out of bed. That's a sign. Feeling overwhelmed all the time, sleep problems, irritability, poor work attendance or a drop in performance, and again, that may feel really hard because we're kind of wired to be competent to help others. And so if we're not doing well ourselves, again, and somebody, a boss says something, oh, you're behind on your notes. Well, and I take a personal offense to that. There may be some burnout going on. And you may need to get a little bit more help. I'm not going to go through this whole slide. As Elaine said, you will get the slides, but there are specific risk factors for burnout that also are going to correlate with what we're going to talk about systems interventions for resilience as well. And so again, job demands. Do you feel like you have control? Do you know what your role is? Is there adequate reward? Even if many of us are in professions that don't pay a lot, we're here for other reasons. So salary is not often the reason that you're doing the job you're doing. There's a lot of different rewards to get out of it. But are you valued? Do you feel valued in your workplace? That can be a huge reward and help with burnout. Community, feeling that things are fair, and that the organizational values are at least kind of matching or congruent with your values. Lots of reasons. We've already mentioned a few that we have burnout in health careers. Lots of challenging patient interactions. Many of you do long, late weekend work, overnight work. It's a lot. There's a lot of empathy fatigue. By the time maybe you've seen the 20th teenager who's out of control, sometimes it's hard to really have the empathy to do that individualized care that they need because you're just tired. And behavioral health professionals work in spaces that are filled with trauma, filled with, basic needs that are often unmet in the families or the individuals we work with. Ongoing crisis. The emotional intensity is often really high. There's often a lot of ethical complexity. I think about those of you on the call who are in more rural areas, and there are not the resources that we would hope you would have. Are there sometimes these dual relationships with some of our clients? I remember when I was up in Rhode Island for a number of years. So Rhode Island is a state that is like basically a big city. It's not very big. And so you run into people all the time. And so how do I, be a therapist for a patient who has a very severe eating disorder? And then I go to a July 4th party with friends, and that patient's dad, who just got divorced from the mom, is also a guest at that party. There's ethical complexities. The caseloads, I think, are another thing, and we'll talk more about that. And again, our systems, all of our systems are stretched thin. We know that. We're very fortunate that Virginia recognizes that behavioral health needs more resources. But there's still going to be time between, okay, I'm working on the ground right now and don't have the resources, even hopefully as they're coming. So why is this all important to manage? You know this. If you don't take care of yourself, you can't take care of others. This is stuff we tell parents all the time. You know, if a parent can't take care of themselves, they can't take care of their kids. As a provider, as a whatever role you have, if you don't take care of yourself, you can't take care of others. You know, I like these images that one, you can't pour from an empty cup. Okay. You at least need to refill your cup. My daughter likes to use the spoon analogy that, you know, you only have so many spoons, and once all the spoons are gone, you know, you're done. You're exhausted. So you got to figure out, how do I keep my spoons? How do I fill my cup? There's also the idea of boundaries, and that's what this bubble kind of shows, that you really do need to have healthy boundaries in taking care of yourself. And again, I think a lot of us forget that. We're going to talk more about that. I have to say, I love Mellow Doodles, and I love Positively Present on Insta. If you ever need some motivational things, those are my two favorites. This particular one I've saved for a while, but it's just a reminder that our brains were not designed for constant notifications, endless channels, multiple apps, 40-hour weeks, plus 5 social events. And again, the 40-hour weeks are probably 60-hour weeks for many of you. Texts, messages, emails, and WhatsApps. No wonder we feel overwhelmed, frazzled, and on high alert. Let's slow down, turn off, reschedule, and delete whenever we can. It's time to give our minds the quiet and the rest they need. And I think about technology. You know, technology has helped us do so many things. And I remember the old days where I had to carry a beeper so that if somebody really needed me after hours, they had to put in a number and it would beep, and then I could call someone. Now with cell phones, people expect text response right away. People feel like they're on call 24/7. And just out of curiosity, how many of you have your work email on your phone, like on an app? I see a lot, the people with cameras on, I see a lot of hands. You know, again, this idea that we're available 24/7. It's exhausting. It's exhausting. All right. So before we turn to resilience, actually, I just want to ask, any questions so far laying this groundwork? Does anyone have any questions around? Yep. So when we were talking about email on the phone, Todd said, I've avoided it due in part to that fact, the 24/7, but also a FOIA request. Absolutely. Our phones, if you do anything work related on your phone, it is open to subpoenas, information requests. Okay. And it's great if you only have a work phone. That's great that a lot of you guys have separate work phones. At the same time, again, the question is, where are the boundaries? Oh, and that's wonderful that it's against policy to keep work on your personal phones. I highly endorse that. So, okay, turning to resilience. So, as we mentioned, behavioral health professionals work in spaces that are filled trauma, crisis, emotional intensity, complexity, often under-resourced systems. And resilience matters, okay, for us, for the providers. But it's often misunderstood in ways that place unfair pressures on providers. Again, this idea that resilience and self-care are the same is a myth. Okay, there are self-care things you can do to help build your resilience, and it's not enough. And we're going to talk more about that. So we are coming to our first breakout room. I would like you to do before we define resilience, you've already heard a little hint on what my thoughts are. But I'd like you in your small groups, you're going to be in a group of 5. We're going to just take like 5 minutes and talk about in your group, what is resilience? What ways do you feel you're already resilient? How do you know? What ways are your colleagues resilient? Okay. And then when we're going to come back, I'm going to ask some members to just unmute and share what you discussed briefly in your groups so that we all have a nice idea of what everybody feels resilience is before I jump into my thoughts. Okay. So Elaine, we're ready for the first breakout groups. Great. So I got to hear a few comments from the main room. A couple people stayed. Can anybody from some of the other groups, are you willing to unmute and just give us a couple of ideas of what you guys talked about that resilience is and what ways you're already resilient, you or your colleagues?
My favorite was from, I see, I'm not good with names, so I can't remember her name, but she said she views resilience and talks to her clients. You grow through what you go through. And that's one I hadn't heard before, and I liked that. So I wrote it down.
What you go through. I like that. Thank you. I heard
One of the things in the group that I was in that we spoke about is just having the ability to bounce back stronger than where we were before, to take those flaws or mistakes and turn them into something beautiful in order to help ourselves and those around us. Just the ability to bounce back.
Mm-hmm.
I love that. I heard that in our group too.
Yeah, similarly in our group, it was like rolling with the punches, or, how do we, take care of ourselves while also holding space and highlighting to the client we're working with their resilience.
Yeah.
And being able to, within our team, with colleagues to hype each other up and remind each other that we're also resilient. And also wanted to say apologies for joining late. It was actually navigating a client crisis, so very happy to be here and very fitting for today. And I had actually had an undergrad worked at the JMU clinic. So really great to see you again and appreciate your time.
Yeah, I recognize a few faces from some of the trainings I think we've done too. So great. Anyone else? Those are awesome. I mean, I'm hearing the social support, the bouncing back, grow. Yeah. Anyone else?
We talked about how we all kind of feel like resilience is developing a set of coping mechanisms that to help just push us through, to help us keep going when there are challenges in either our careers or life itself.
Mm-hmm. I like that because, one of the things we forget often because you're so focused on helping others, you're dealing with stuff in your own life too. I used to joke that, when my kids were teenagers in particular, I could manage anything if there was stuff going on at home or if stuff going on at work. But as soon as both went out of control, that was kind of where my limit was. So, yep. Good. Any other comments? Those are great.
We just talked about 2 things, like seeing growth, like when you're doing something the second time and you notice it's easier the second time around because you've been able to bounce back and come back stronger. And then we also talked about I feel like a common misconception with resilience is that like you have to be optimistic about stuff all the time. And that's not the case. Like, it is what it is. It could still suck, but the fact that you're resilient and come back and do it again, like, that's okay. So just taking out like the optimism from it, and it's more like realistic.
Yep, I love that. You guys are hitting on some great things, and we're going to talk a little bit. I want to highlight that optimistic part because when we start talking about some of the coping skills and we talk about challenging our thoughts, it doesn't mean you've got to kind of put in a positive thought. We're just trying to actually go more towards a neutral thought, not positive. We'll explain that a little bit more. All right, excellent. Great job. And I think when we get to our definition here, the official definition I want to share is enhancing the capacity for successful adaptation in the face of stress, challenge, and adversity. Okay, so I think you all in your groups hit a lot of those different points. And again, my little things, I love Kermit, eats flies, dates a pig, and is a Hollywood star, right? Live your dreams. You don't have to be this perfect, there's no one path. And living up here in Northern Virginia, that's a particularly hard thing to teach, particularly the kids. They're all in this highly competitive mode of, oh my gosh, I got an 85 on a test, and we have to help them learn that, wow, that's okay. It's not the be all and end all. We have to help the parents too. And I do also like this Alice in Wonderland. It's not hard to make decisions once you know what your values are, and so when we're thinking about resilience too, it is important to think about what are your values, your family values, your cultural values, what are the organization that you work for, what are their values, because that really helps when you're talking about this successful adaptation. If we go back to our values, then it puts some meaning in it and it makes sense versus, if you are, if you have certain cultural values that are really at odds with this organization that you're working for, there's going to be more stress. There's going to be more difficulty, and it's going to be hard to help others as well as build your own resilience in that system. So this is the handout. I'm not going to spend tons of time on this because I do really value the conversation. And again, feel free to use the chat. I have it open, so I'm keeping an eye on it. But when we think about what resilience is and what it's not, so as I said, this is one of the handouts that I put the Google link in. Resilience is a process. I did hear some people talk about, some people are more natural and they're born with it. Resilience is not, it's a muscle and you can build it. Having said that, it is not, there are people who do tend, it's easier, I guess is just the best way to put it. But it's not like, okay, you're born with an eye color and you have it or you don't. Okay. Resilience can be built. It's a process. It is the ability to adapt and recover. That is really important. So I think I'm seeing we will post those Google links again.
I'll take care of it.
Thank you. It's also, I heard a lot around social support and connection, and that is resilience. It's relational. It's not just individual. As much as we would love to live in our own bubbles at times, we don't. Everything we do is within a system, whether it's a family system, whether it's a work system, whether it's in a relational, a significant other system. Everything is connected. Resilience is also rooted in healthy boundaries. Again, if we're available 24/7, how long can we last that way? How long until we're just exhausted and burnt out? I think about this too with the current climate that we're living in right now. The news cycle is constantly bombarding us, and because of all the technology, it's 24/7. And people get really fatigued, and putting some of those boundaries in place, is really important. Again, an example in my own life is that I have my headlines that I look at in the morning after I've had coffee and gone to the gym before I start my workday, just so I have a sense of what happened in the world. And when I get home and I'm trying to spend time with my family, I don't open any of my social media accounts because that's not the time that I want to be bombarded with what happened that day. I'm fresher in the morning. I know that about myself. So I'd rather have that extra time built in the morning. And I set that boundary, around news. Okay. Again, you're going to hear meaning. What are your values? A lot of us go into this field because we truly want to make other people's lives better and help them make their lives better. There's a lot of meaning in what we do. And then, as I've mentioned, resilience is really supported by healthy systems. This could be your boss, the leadership, the institutional values. The systems that you're in really do make a difference. So what resilience is not is what we call toughing it out, ignoring that exhaustion, working through the emotional depletion. If you're at that point, that's not resilience. That is drudgery, just trying to push yourself forward. So again, there is that fine line because there are a lot of times where we can't just say, oh, I'm taking today off. And yet, if you're at that kind of tipping point, we want you to talk with your supervisors, to talk with folks, because toughing it out is not resilience. The other piece is, we started with burnout. Burnout, secondary trauma, holding other people's traumas are what we call occupational hazards. And needing support, needing help does not mean that you're incompetent, that you're not cut out for this, that you have failed. Okay? So that is not a personal failure. And I do think a lot of us take it, oh, if I'm not able to help this person, then I'm no good. It's my personal failure. And that's not resilience. Okay. Resilience is thinking through what have I done to help this person? Have I consulted with my supervisor? Are there things we could do differently? How could I grow from working with this client? It's also, as I said, not endless self-sacrifice. Again, martyrdom is not sustainable. I've been guilty of it. I think everyone in our field has been guilty of, oh, I just need to do one more thing, or I just need to be available. Again, that's where those healthy boundaries actually really help reinforce resilience. Not just more self-care. Some of this building resilience does not mean taking more bubble baths. I loved that example on that. Yes, there are self-care things. There are coping skills. But you can do all these individual things and still need to work on building resilience through your social connections, through your work systems. It's not just more self-care. And if you do find yourself in a harmful system, that is not resilience. Just getting through the day in a harmful system is not resilience. Questions on that? No questions. Okay. So, just to summarize, and again, it's not a personality trait. These are much more, again, characteristics that you can build. But resilient people do have a growth mindset. They have deep and genuine connections to others. And again, doesn't mean you have to be best friends with your boss. That's not what we're saying. But you do need to have a couple of genuine connections. Feeling competent takes a lot of practice. The imposter syndrome, I think, kind of stays with you for a long time. And is everyone familiar with what the imposter syndrome is? And saying mostly yeses? Okay. So basically it's like, I may have finished a degree, or I may have done all this training, and yet somebody thinks I'm capable of doing this, but I'm just like faking it. It takes practice to tell yourself, I am competent and I'm also growing and learning. And if you fail, if you make a mistake, the question is, do you wallow in it? Do you hide? Or do you grow from it? And many of you said that growth piece. And it's not necessarily tied to your identity. If I really make a major mistake with a graduate student I'm working with, I'm going to own that. And I'm going to talk about how can we move forward from that? What can I do differently? What can the interaction look like differently? And it doesn't mean I'm a terrible director. It means that I messed up and I need to take steps to grow and correct that. I love the positive outlook. I did leave this on here because often for people where building resilience is a little easier, they do tend to be people who have positive outlooks, like it'll all work out one way or another. Having said that, that's not a requirement. So just so you know, that's not a requirement to develop resilience. Creative. We haven't mentioned creativity yet, but often resilient people and people who build their resilience muscles tend to be very creative. Thinking about how do we grow? What are some different ways we can approach a problem? What are different ways we can deal with what's going on at work? Keeping an eye on time. So how do we build this resilience? Somebody did mention, I think, kids. Kids do tend to be much more resilient because they haven't, especially younger ones, they haven't learned that it's not okay to make a mistake yet. Unfortunately, we train our kids to not want to make mistakes. I remember again a time with my son was getting very perfectionistic when he was little and didn't want to get messy. And the pediatrician said, and we like to bake together. I always loved to bake. And that was an activity we did together with our kids when we were young. And the pediatrician said, when you're baking, drop an egg on the floor. I'm like, what? Drop an egg? Yeah, make a mistake. Do it intentionally, but model, and then model that resilience. How do we handle when the milk spills, the egg drops? We model that, oh, okay, we made a mess. Let's clean it up. Let's go get that paper towel and clean it up. Okay, that's building resilience. We don't do that as adults very much. And if we did, I think our system would be more resilient. But you can build it. I do want to highlight there's no one right way. Every one of us on this call and in this training has different ways that you are going to build resilience. So when we get to the second half and talk about all the different ways, I want you to think about what works, what you want to try that might work for you. Because there's so many different ways to build these resilience muscles. And we're all different. We come from different cultures. We come from different backgrounds. We come from different age groups, different generations. And the way we're going to build these resilience muscles has to be different based on who you are and how you want to grow. Okay? It's also a myth that if you are a resilient person and you've built these resilience muscles, that you're never going to get anxious, stressed, or depressed or sad. That's a myth. We still feel stress. We still are going to get anxious sometimes. Sadness is a normal emotion. Frustration, these are normal emotions. You can be resilient and still experience all these emotions. So we're not trying to shut off our emotions as we build our resilience muscles. Questions about that? I'm not seeing any questions in the chat, but just making sure. Okay. So this model here, we developed here at Mason based on a lot of the literature. I was involved a number of years ago with our Center for the Advancement of Wellbeing, that we wanted to kind of have some model to share with the entire Mason community and our Northern Virginia community that made sense and recognized those individual differences, and also was based on what the research says really helps build these resilience muscles. And so we came up with 5 kind of what we call buckets that really contribute to building your resilience. So one is physical well-being. Thinking about your last week. How many of you got enough sleep, ate relatively healthy, and got 30 minutes of physical activity, even walking 4 or 5 times last week? Anyone? Not me. Okay, we have 1 yes. Yay. For the most part, yes, no, never. Okay, so all over. Of course not. I love it. So, it's a range. It's a range. And physical well-being on the very basics, sleep, nutrition, physical activity, that helps you build resilience. When there are certain weeks at work where there are so many demands that you get exhausted. You wake up in the middle of the night thinking and planning. I do lists in the middle of the night, which is not ideal at times. But if we don't have that very basic physical well-being, it's really hard to continue to build the resilience muscles. I know that I've had days where I'm so exhausted, oh, poor Jennifer, 7 hours a night. You get so exhausted that one thing happens at work that's normal, but it's that tipping point and you're almost near tears, even though it's not that big a deal. Okay? And your ability to use your coping skill at that point really diminishes. The second bucket is those coping skills. And again, we're going to get into those after our break. What are some very specific coping skills that you can think about, you can utilize, learn to use, and put them as part of your own personal resilience building plan. Social support, absolutely critical. Okay? Again, we don't live in a vacuum. We just don't. Social support in some form or another is critical. Positive emotions. So just as all of the emotions are normative, having and experiencing some positive emotions, not all the time. No one's happy all the time, but experiencing some joy, some happiness, some activities that bring you pleasure is really important. Okay. And that ties to the meaning in life. what is important to you, both as a professional, but also personally, because they do interact as well. Mhm. All right. Thank you all for sharing. Oh, that sleep part is really tough. Okay. Behavioral health setting. What are some of the issues that kind of impact both burnout and resilience? What do you guys, anyone want to put some in the chat? We've shared a number of them, but what are some of the things that affect you as you're working and whether or not you feel closer on the burnout versus can build that resilience? Changes in schedule, absolutely. Lack of control of workflow, secondary trauma, high caseload, lack of support hours, changes in expectations. Yes, that's a big one, those changes. Lack of communication, staffing shortages, when policy doesn't always allow for best practices, demands, work from home isolation, that's a newer one. I'm going through really quickly. Boundaries not being respected, including that admin time, accountability, 3-day weekends. That helps with the resilience, okay? Conflicting hours of work. Death never stops. Yes, a hospice social worker. Yeah. You guys are hitting almost all the ones that I have. And I think this contributes, the never-ending work, and the staffing shortages. We just don't have the behavioral health workforce. And that is something I think the state is really trying to focus on more, but doesn't necessarily help you right in this moment. Power differentials, right? So depending on your level in your system, you may not have the ability to speak up about your, I like this one, productivity expectation without considering the barriers to treatment, or, the unreasonable expectations due to large caseloads. In addition, I think somebody who put down too, not only the difficult time demands, but the time sensitive demands. Very time sensitive. I see somebody just put on some forensic involvement as well. Somebody had mentioned that they work in hospice. That's difficult just to be around that all the time. A lot of behavioral health providers have perfectionistic tendencies, and that can work against you as you're building your resilience muscles. Is it okay to be good enough? And a lot of people say, no, I've got to get everything done well. But thinking about, is there a good enough? Students with extreme behaviors, unknown trigger, absolutely. So I think, and again, go back. So let's say sometimes life or death situations, that is what I was thinking about when somebody made the comment about students with extreme behaviors and unknown triggers. Where we all deal with clients who are dealing with suicidality, homicidality at times. We live in a time where it is scary to think about somebody who has a trigger temper and owns guns. And so, you guys are on the front lines for that. The expectations that a lot of you all put that in, the expectations of large caseloads, of not having time. And I say real or perceived because a lot of these are absolutely real expectations. And we often will end up adding expectations. I'm going to get in trouble if I don't get my case notes done. And then they're going to think I'm a poor employee. So I'm going to spend until midnight getting those case notes done. Rather than the idea, with, okay, I really cannot get these case notes done. Let me talk with my supervisor to see if they have any ideas on how I can do these differently, or do this differently. Okay. We want to handle it. And then stress at home that impacts work. As I mentioned, again, I can handle all the work stress as long as home is going relatively smoothly. I can handle the home issues as long as work is going relatively smoothly. When they both go out of control, oh man, that's where it gets too much. And that happens to everyone, absolutely everyone. Anything else that we've left out? Feel free to put them in the chat. I do, before we go on the break, I just want to share one quote. So Dr. Nancy Lamphere is a dear friend and a developmental behavioral pediatrician. If y'all haven't guessed, I'm actually a pediatric psychologist by background. So a lot of my passion is working with teenagers and kids. But she really goes into this whole resilience mindset. And her quote is, as healthcare providers, you will have the privilege of being with people at times of joy and pain. As much of our work is in disease or disorder care, you will see more pain than joy. It is easy to take on this pain and suffering as we are encouraged to be empathetic, suffer with, and to believe that our role is to fix. I encourage you instead to be compassionate, to journey with our patients and their families, always allowing yourself self-compassion as well. Find colleagues who will be true friends and confidants. We all need a safe community. Find ways to stop and truly live in the moment. Contemplative practices such as meditation or yoga can help you remain healthy, whole, and compassionate. So we're going to take a break, and I'll just leave that up. And again, meditation and yoga may not be your thing, but we're going to talk about other things that might kind of help you be in the moment. But I really appreciate her perspective from the suffer with, be empathetic and fix versus journey with and be compassionate. All right. Elaine, I think we have our 10-minute break now. Is that correct?
That is correct. I will put up a video. You guys can stay connected, but feel free to move about your personal space as you feel necessary to, and we'll see you back here in 10 minutes.
Mm-hmm. All right. I love that, by the way, Elaine. That I've never seen like a clock that ticks down like that.
Some of us need constant affirmation that we still have time left.
It's great. Okay, I'm going to reshare. Thank you all for hanging in there. All right, so.
Looks good.
Looks good? Great. So I did want to give a shout out to Dr. Deborah Goldberg up here at Mason, who studies healthcare worker well-being, and she really addresses systems. So for those of you who happen to be supervisors, managers, and those who are not, but want to take this presentation back to your systems, I wanted to have these slides in so that you had a couple of concrete ideas of what contributes to resilience in the workplace from a healthcare perspective. So the first one, as we've been talking about, resilience matters, and resilience it reflects growth, right? The growth mindset. Well, you can't make mistakes if it's not safe to make a mistake. And so one of the things that she highlights is we want to build workplaces where staff can speak up, where their employees, folks can report mistakes, raise concerns, discuss safety issues, but without fear of punishment. And I don't know how many of your systems have that or not. We work very hard to separate, okay, what is a mistake that you can learn from versus a crossing of a line that would be like not acceptable, and make it very clear. You know, we have clear policies. But to build your resilience, you want to have a culture of trust, ideally. Everybody has commented on this, the long hours, the documentation, the staffing, the tremendous caseloads. You know, I think that is one of the things that will be interesting to see in the next 5 years or so, 2 years, around whether AI actually is able to be utilized in some of our settings, maintaining HIPAA, maintaining FOIA, but maybe decreasing documentation burden. That seems to be one of the main areas that is coming out very quickly. And again, if they're able to figure out how to make that a closed system within your systems, I think there's a really good chance that that will help decrease some of the documentation burden. Violence and staff safety. You know, again, making sure your systems have very clear guidelines for what is acceptable and what is not. And given that many of us are dealing with clients with some pretty significant mental health issues, you know, those very clear boundaries need to be set. 0 tolerance for violence, verbal violence, physical violence. How do we de-escalate? Did you get the proper training to de-escalate these situations if they occur in your settings? Are you going into someone's home by yourself? Do you know what to expect? Do you know where to stand, you know, until you're able to assess the situation? These are all kind of trainings that help you feel safe and increase your resilience. This is one of my favorites. You know, again, running a training clinic that serves the community. Yes, I'm the leader and the final decision is with me, but some of the best ideas come from our trainees. Some of the best ideas come from our community when we listen to the people that we're trying to serve. And so involving people, frontline staff in decisions can really help both employee well-being, but also that creativity I was mentioning that builds resilience is, you know, you're on the front line. Maybe you have some ideas of how to make this system better or this policy better. And if you have some input into it, it's more likely to succeed. And then last, take some time to really check in on employee well-being. We always track patient outcomes, financial, you know, quotas. You guys were all talking about the quotas and the, you know, the RVUs for if you're in the hospital setting. But if we measure what your burnout is, your well-being is, your resilience skills are, that can actually give a lot more information on what needs to happen to take those next steps. So those are just my systems advice. So any of you who have some influence on those systems, feel free to share these slides. Okay, so now we're shifting to kind of the personal. What can you personally do to increase your resilience? And the answer is a lot. And this may look different for each of you as you build this resilience muscle. Anyone who works out knows that you also have to continue to work out to maintain that muscle. So this is not a one-time thing. I like that. Set boundaries. And that's hard to do. It is. Just a quick reminder of some of the different areas we're going to touch base on. But we're going to break it down into 5 different types of skills that you can practice. And notice that boundaries is one all by itself. So yes, Absolutely. So the first one, though, is what we call affect management. What that means is being able to regulate your own affect. Affect is your feelings, your expression of it, your body response. So when we get stressed, when we get anxious, when you have those hard moments, often your body tenses, your heart rate might go up. Your palms might get sweaty. You carry the tension up here, other places in your body. You might get a stomach ache or a headache. So one way to get control of kind of your body, your mind, besides, and I like that, Karen, be patient and kind to yourself. There are very specific relaxation strategies that can be done. And I truly advocate picking one that you want to practice. So snake breathing I use with little kids. You're breathing in through your nose and out through your mouth. And that's it. Now you are making noise, so that might not be the most appropriate one in your work setting, but in your car, great one. Box breathing. Have people heard of box breathing? Okay. Box is basically you're slowing down and controlling your breathing. You're breathing in for 4, holding for 4, releasing for 4, holding for 4. Okay. So these are all breathing techniques that you can do. And there's lots of ways, again, to do it. My other favorite is blowing bubbles. And again, maybe this is the pediatric psychologist who works with kids and medical issues, but it works with adults too. Blowing bubbles. So literally a thing of bubbles. Okay. When you take a deep breath in and blow. What happens in your office if you were to do that with a client and they were to practice this? What happens? Any ideas? If you blow really fast, are you going to get big bubbles or a lot? No. So you have to blow through. And yes, thank you. You start laughing. People laugh when they see bubbles floating around. Okay. It's the best thing. They'll think you're playing games. But when you do slow, deep breathing with bubbles, you're actually decreasing your heart rate. You're bringing your physiological response down. You're able to think clearer when that happens, through any of these relaxation strategies. But I love the bubbles because, again, people laugh and it helps with your blood pressure. Absolutely. So you also are getting a little bit of that positive emotion I mentioned when you're using this very simple, inexpensive intervention. My family laughs at me because I don't go anywhere without bubbles in my purse. And I was very happy to, again, teenagers, they all just kind of laugh at you as parents. But yet when my daughter went off to college, she asked for a box of bubbles and she would give them out to her friends and explain that they had to make big bubbles or lots of them, depending on which bubbles. So I highly recommend bubbles. Making lemonade. This is a progressive muscle relaxation. Again, the idea is to try to get the body to relax, which allows the feelings not to be so intense, whatever those feelings are. And a really quick one that I teach kids is if you use your hands and you're squeezing lemons really tightly to make lemonade, again, kind of infusing a little of that positive emotion, and then relax and let your hands fall to the ground. Might even talk about your arms being like spaghetti. And then do it again. And this is something you can do under the desk. Kids can do it at school under the desk and nobody knows they're doing it. But when you tense the muscles up really tight and then intentionally release them, you actually are relaxing the body again. Okay. last one that we'll talk about today on the affect is grounding. Okay. There are all kinds of ways to do grounding, but the idea is, again, to get out of your head and just get into the moment. So if you can actually focus on your toes inside your shoes, a lot of times I like to have a worry stone that you can kind of just rub and kind of think about. But in schools, they often do the 5, 4, 3, 2, 1 method. And that is a very simple, very quick. You can Google kind of a handout for it. And then it's consistent across settings, but it's also really good for adults where you just pause and name 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 thing you taste. By the time you've done that, and again, we're not talking a long time, we're talking, a couple minutes to do this. You've refocused your mind on kind of what's right around you and present. Again, helping you bring that affect down to be able to think through things. There's also these self-soothing, I guess is the way to call it. Lots of different things you can do for self-soothing just to kind of reduce the intensity of the emotions, whether it's, again, using your sight, touching things. Honestly, a hot or a cold shower, if you have time, is excellent as a way to kind of help you regulate some of that emotion. Sounds, smells, tastes, an ice cube is very effective as well. Literally just putting an ice cube on your wrists can help you kind of calm your body down a little bit. Aaron's thinking putty. Yes. So, putty, just something in your hands, again, helps you ground to the moment rather than thinking about all of the things. Any other things that people think about for affect management, regulating? So vagus nerve activation breathing. I'm not familiar with that, but I'd love to learn about that one. Touching the earth. Yeah. 5 minutes to go outside. Nature. Oh gosh, nature can be wonderful. Pilates, weighted blankets. These are great ideas. Great ideas. Hugging your dog for 5 minutes. Oh my gosh, pets can be the best. The other thing I also encourage is find out in your systems whether with clients you're able to go outside. There's a big difference between sitting in a room and talking one-on-one versus, hey, do we want to go, shoot baskets and talk if there's a basketball hoop nearby, or just even be outside near a tree. Some places allow it, some don't. Our students have to get extra permission from the client because, again, there are issues that maybe confidentiality is not maintained the same way as in a private therapy room. But the amount of work you can do with somebody when you get kind of into a little bit of a different setting is pretty remarkable. I like the sauna. By the way, I can't just say I'm a dog person only, but cats too. They can be temperamental, but just even petting a pet or listening to the purr, that can be a real affect management. Taking clients fishing, yeah. Again, you have to be really careful with those boundaries, but as long as everyone's clear on what they are, again, a different setting can make such a big difference on that therapy side. Great, thank you. So cognitive-based therapies. These are things, or cognitive-based resilience strategies, sorry. These are things that, and I just lost my chat, hold on. There it is. This is kind of what you're doing in your head. This is what are my thoughts, noticing your thoughts and reframing to something more helpful. And when you're doing cognitive therapy or cognitive behavioral therapy, the idea often is to identify what the thoughts are and ask 2 questions. Is it true? And is it helpful? When we're talking about resilience, our goal is it helpful? Because a lot of times negative thoughts are true. Maybe they're not. But in reality, it doesn't matter. If they're not helpful, that's not going to help us with our resilience. So again, our goal, something happens, could be anything. You have thoughts about what happened. You experience those emotions based on the thoughts, and you respond to the thoughts and feelings with behaviors. When they're not helpful behaviors, when the stress goes up, this is where we want to kind of jump in to build that resilience muscle. So what do? You want to catch the thought, identify it before the emotion kind of takes over. If the emotion takes over, go back to the affect management strategy. We want to check how helpful that thought is, and then we want to change the thought to one that is more helpful. And this is where we're kind of challenging some of these negative thoughts, but in a way that doesn't mean changing it to a positive thought. So whoever mentioned early on, just be optimistic, just be positive, just do something, say something that's positive. That's not actually what this strategy entails. It's I have an unhelpful thought. So, I am so overwhelmed that I will never, ever be able to catch up on my work. Okay. Not a helpful thought. Building this resilience muscle, I'm not going to say, oh, of course it'll all work out. No, I'm going to catch it and I'm going to say, okay, maybe I'm so overwhelmed. I have so much to catch up on. I wonder if I can talk to my supervisor to set a plan for this. Or, yeah, I have that thought every month. Or, okay, I wonder if I do just take a moment to do some grounding, whether I will feel that I can handle this a little better. Okay? So notice that none of that is, okay, everything is going to be great, but more trying to have a more helpful thought. And that's that resilience piece. Okay? A lot of parents I've heard these days, I'm keeping my child home from school because it's dangerous to go to school. I'm not going to argue whether that's true or not, right? A parent's most precious is their child. And there are a lot of dangers everywhere. The question then is, can that parent reframe to a more helpful thought of, wow, I'm taking some steps to keep my child as safe as possible while they're learning. What are those steps? What's in my control? Okay. And that shift, right, that reframing of the negative thoughts potentially can help increase resilience and decrease stress. Questions about that? Okay. Next one, meaningful activities. Values-based, is that a question? How to get out of a mind loop? It's hard. And that's where I think using many, of the negative thoughts, many of those skills. So it might be first recognizing that you're in that mind loop, then doing some affect management, calming your body down, which allows you to kind of have a little more control. And then I would actually argue that's where then your social support comes in, because you recognize it and you may feel stuck about what is the helpful thought I can replace it with. Well, what would you say to your best friend if they came to you with that same thought, with that same loop? Does that make sense? So again, we're pulling different resilient strategies to help get out of that mind loop. Values-based resilient strategies. So meaningful activities. And this is both at work, but also outside of work. You know, we tend to have our identity so tied up in our work and helping our clients. And if we don't have some meaningful activities outside of work, it's really hard to build and maintain that resilience. So whether it's volunteering, that's up to you. Sometimes maybe it's a family volunteering. Some religious or cultural practices that really kind of connect with you and give you meaning. Friend or family based, whatever is meaningful to you, that needs to be incorporated to build these resilience muscles. So the piece, for me, as I mentioned with when my kids were little, I liked to bake. And in college, I remember that my roommate used to love when I got super stressed because I would bake. And the whole hall would get cookies because I was stressed, so I would bake. That was my meaningful activity. And then it became more meaningful over the years when I could do it with my kids, or even now when I did it with my mom to learn a recipe that she had done. So again, incorporating some of those meaningful activities is really important. That connection and social support, and this will tie in a little bit with boundaries as well, is do you have folks at work? Do you have folks outside of work that can provide that social support and connection? And this is not just a venting. Building resilience, if you get together and just vent, then that actually perpetuates kind of that negative and towards that burnout. If it's problem solving, if it's working on, resilience or a meaningful conversation, a values-based conversation, that's going to increase resilience. When I mentioned the boundaries, I'm very fortunate that my husband followed around for my career because I have worked a lot. But he also provided feedback. A, if work was bleeding into home. B, if the hours were starting to creep up way too much. If I was going to take on a new opportunity, we would have a discussion. What did that mean logistically? What did that mean as far as my exhaustion and my ability to be present with my family and with him? And that support over the years, most of the time, has really helped me building in my resilience muscles. So thinking about what you have in your life, the connection, the social support. Okay. Last, I also want to mention the values-based resistance strategy, gratitude. There is a lot to be said, and there's a lot of research that supports when you express gratitude, it helps you build your resilience. And for some people, this looks like journaling. I do the 3-a-day mantra. If you can mention 3 times a day something you're grateful for, or put 3 things you're grateful for each day in a journal, 2 weeks, the data shows that actually improves and lifts your mood tremendously. Okay. So, I love the idea of journaling, and I saw Portia loves journaling and it helps. I don't have time to journal and I don't want to write that much by the time I'm home and after work. However, that 3, jotting down 3 things that I'm grateful for, it's easy, it's quick, and it helps me reframe. And that is really something that has a lot of data in the back. Okay. All right, let's see. Okay, so boundaries. This is hard. It is really hard to set healthy boundaries. And, one of the ones I first, I love by the way, I love all the suggestions that are coming in the chat. So please take a look at those. And also put, how do you set healthy boundaries in the chat? Oh, I love Legos, by the way, too. I keep Legos in my office, and that way, again, if you need something to do. Adult coloring books are great. Painting. There was an acronym somebody put. Lori, I think. Hold on a second. Oh, think. Is it true? Is it helpful? Is it inspiring? Is it necessary? And is it kind? I love that. Love that acronym. But yes, it should apply to yourself as well. How do you set healthy boundaries? Okay. Honest with yourself. Admit who you are, what you need, and where to set those boundaries. One of the things I like to share when we talk about resilience and well-being is this idea of balancing work and home life. And those who know me well know I hate that word, balance, because it's never, balance means you're trying to achieve something that's really unattainable. Rather, recognizing that there are times that work may take precedence, family may take precedence, and that's okay as long as I'm clear on where my boundary is and how long that's going to be. Okay. I like, yes, setting realistic expectations for yourself. It's okay to say no, and you don't necessarily have to explain it. Sometimes it's easier if you are able to kind of say, instead of just flat out saying no, say, this is what I need. This is, I want to be the best person, the best employee for you, and this is how I can do that. Mm-hmm. And not feeling guilty if you do say no. And that's hard. That's especially behavioral health providers. I think we totally want to say yes to everything. And again, it helps when you have social support to say no. It's not all on you. We're in a system. Tap your support. Other thoughts? So email, apps on the phone, there literally are apps now to tell you to get off your social media. There are apps that will set timers so that you don't get lost in TikTok or Instagram. I mean, because again, that's not going to help you build your resilience muscles either. I'm thrilled those of you who have work phones versus personal phones, but are there clear boundaries as to when those work phones get turned off? Do people rotate being on call so that nobody is on call 24/7 all the time? Those are just some very kind of typical things that we forget. Don't check your email after hours. Again, people are so used to instant response these days that, setting that boundary is okay. You might even see on email responses sometimes, I work unusual hours. Please don't feel free, or please feel free to not respond, outside of business hours. So, think about what are those boundaries. Okay. All right. So a couple of very basic, this is my really fun resilience building strategy. Make a toolbox. Okay. When you are stressed, when you're getting towards that burnout, it's really hard to think, what do I want to do right now? Okay. And if you're not somebody who carries a thing of bubbles in your purse like I do, you need to have some physical prompts to remind you what you can do. So make a toolbox. Collect your favorite ideas, make them concrete. Maybe your box will include, and you can decorate it, a stress ball, definitely bubbles, maybe a bottle of water, just so that you make sure you're hydrated. Pictures of your favorite activities. For some of you who paint, maybe it's an adult coloring book or paint supplies, pictures of family, friends, whoever your social support is, coping cards with your statements, whether they're motivational, whether it is a positive self-statement, whether it's a reminder that you are competent, that you have great qualities. Some people even put those things on your cell phone, the front. A lot of teenagers, I'll have them put their motivational statement right on their homepage, or their picture that reminds them of their coping strategies right on their homepage, because everybody has their phones. But think about how you can make this toolbox so that you actually have something concrete to go back to. And calm down jars. I like that with child clients. You know, I have found over the years, almost everything that works with child clients really helps adults too. So, you know, and it's often, if you're working with a family, it's something a child and a parent can do together. And then we're also building the relationship. Okay. Last, in the moment before I'm going to send you, I'm looking at time, but we are going to send you to one more breakout session to develop your own plan for the next couple of weeks, because I do want everybody to have some concrete things they're going to work on. My favorite in the moment tips and tricks at work. Okay. I'm guessing everybody uses the bathroom at some point during the workday. Fair? How many of you run to the restroom, run back because you got to get to your next client meeting, finish your work, whatever it is? Guessing a lot. Walk mindfully. Just try it for a week. Instead of running to the restroom, running back. I did this. This was actually a coach who once said to me, what would happen? How late would you be for that meeting or that client if you counted your steps as you walked to the restroom and you took a breath every time you counted and then walked back taking a breath? And guess what? It made no difference whether I was running or I was walking mindfully, other than I was much more centered and felt much better going into my next meeting or client. So test it out when you're at work. Even though you feel kind of revved up and I'm running late and I'm running behind, test it to see if you walk mindfully, taking a deep breath, letting it go as you're walking and as you're walking back. Are you really that much later than you would have been? Okay. Sticky notes. That's my other favorite. I have sticky notes all over my desk, everywhere. And, you know, let your clients put a sticky note, a gratitude sticky note. You put something, a motivational or an inspirational thing, and just put them around your office, just so that when you look at something, it's like, oh yeah, I remember that. Okay. If you need a moment, take a breath, text a friend, text a family member. And again, not for a long conversation, but just hey, just wanted to take a breath and see how you're doing, you know, or I'm sending you a smiley face. Can make a big difference to building that resilience muscle. Breathe, any of those relaxation things, and blow bubbles, you know, blow bubbles in your office. Okay, so we have, we're going to do 4 minutes, Elaine.
Okay, no problem.
To send to everybody. Your goal is to get that sheet, the second sheet, handout that says the 2-week resilient plan. This one. You will not finish this in 4 minutes, but I would like you to put one thing on the top line in your small groups that is one thing you are going to work on and in the next 2 weeks, okay, to increase your own personal resilience. We're going to take 4 minutes, go into the breakout, write at least one thing. Your goal could even be finish doing the whole 2-week plan. But think about all the things we've talked about and pick one thing that you're committing to. Okay. And then we'll come back and wrap up. Okay, so hopefully everybody came up with one idea that you're willing to try, a new one, not just something you've already been doing. Okay. Couple of other ideas I just wanted to share. Think about a nature outing maybe with a friend, colleague, family member, even a short walk now that the weather's getting nicer. Highlighting strengths. We forget about that too, and sometimes just with a friend, what are the strengths you see in each other? That can be a huge resilience building strategy. Change a holiday tradition to make it more consistent with your values. Things change over time and there's a lot about traditions, but maybe there's something new you want to add or your kids want to add. Okay. Lots of other ideas, and feel free to put in the chat whatever idea you are committing to, because we do know that once you make a commitment, it's more likely you will do it. Okay. Couple more resources. We'll send it out. We have the modules, we have TED Talks, and then a couple books I really like. Mental health is critical. I do want to just share that if you're ever in crisis, you all know 988, lots of resources. Don't know if you know that our center actually runs 2 emotional support lines, one in English and one in Spanish, that are available to anyone across the state. They're anonymous, free, confidential. They are not crisis lines, but they are emotional support. And that we have found has really been a really great resource for folks. And then I am just going to share a few last thoughts today, which I think a lot of you guys actually mentioned. And I do want to express my gratitude for everyone actually participating. I was sharing with Elaine, the worst thing that can happen in a 2-hour workshop is for the presenter just to talk at you. And you guys were amazing at doing the interactive, sharing in the chat. So I appreciate that. Thank you very much. One kind word can change someone's entire day. I think that is just an amazing mantra that reminds us how much impact those social connections have. And even just commenting, if you're in the store, to say thank you. Makes a big difference. And then the optimistic office. And I am happy to answer questions. And I'm loving seeing all of these commitments. So go do it. If you want, take time to go through the whole 2-week commitment. If not, at least do your one thing you've committed to. So thank you all very much. I really appreciate everybody's participation.